1959, many years ago, I was a sophomore in medical school, and I was smitten by an inappropriate stroke of curiosity when I read a selection in a textbook called Goodman and Gilman about cannabis, which whetted my curiosity because it was prohibited, but medically it sounded as if it was pretty benign. This curiosity led me to read everything in the medical school library, and then eventually permitted me to infiltrate to the heart of the beast, the National Institute of Mental Health, where I was hired as a research psychiatrist to study cannabis. At this time, cannabis was seen as a real threat to society because in 1967, when I was there, all hell was breaking loose with Lyndon B. Johnson trying to keep up the pretext of patriotism as he moved forward on the war in Vietnam. And the anti-war demonstrations were just tremendous in scope. I just wish we would see these kinds of protests again. But marijuana was seen as something dangerous that was being adopted by subversive organizations like California communes. And they saw the end of civilization coming near because the legal governance was breaking down as they sent more and more young men off to be killed in Vietnam. Unfortunately, I came out to California and ended up defecting. And there I fled and did my practice of psychiatry until things started happening in California. It happened starting in the Haight-Ashbury and in the Castro in the response to the AIDS epidemic, where different kinds of effective medicines were unknown. But what was discovered was cannabis would prevent nausea and vomiting and permit the use of different kinds of medicines for treating AIDS and the chemotherapy. Well, this snowballed, and what started in the Castro was taken under the wing of the political pros, and we went statewide, and we passed Proposition 215. 2 years later, same kind of thing passed up here in Oregon. Since that time, I've had opportunities to evaluate over 11,000 patients for their use of cannabis. And what has impressed me is cannabis is both safe, effective, and a viable substitute for many medications used to manage chronic illness that's far safer and free from adverse effects. Unfortunately, the forces of evil, namely the greed of the pharmaceutical companies, coupled with the criminal justice sorehead losers, don't want to admit this to be a medicine and will do everything they can to suppress it.